Antimicrobial resistance, or AMR for short, is a global problem that is affecting our ability to manage patients with severe infections right now. AMR is already a significant issue, but it's forecast to be much bigger an issue going into the future. It's essential that we act now to slow the spread of AMR. Alongside my academic role, I work as a consultant medical microbiologist within the Department of Infection here at University Hospital, Southampton. And our service manages patients here in Southampton, but also patients that come from the broader South Coast region and the Channel Islands. Becca is a University of Southampton student whose life has been forever changed by a severe infectious disease. Becca presented acutely with a rapidly progressive infection syndrome called meningococcal septicemia that involved her bloodstream and her brain.
I kind of went to bed feeling okay and then woke up in the middle of the night and was vomiting. And it was only that it wasn't stopping that made me worry. So that's when I called 111 and went into the hospital. And it took me to intensive care, and I was there in intensive care for 6 weeks, in the coma for 2 of those. And I looked at my body and saw that my hands had turned black, my feet had turned black, and I had kind of patches all over my body, so where the tissue had died. And that's when I started asking what was actually happened. So I had amputations done to both my hands when I was still in intensive care, and then they were trying to save my legs, but it turned out they couldn't, so eventually had those amputated as well. I was always quite keen to not let it affect me, and I wanted to get back to uni, get back to my course. I didn't want it to kind of define my life. Since then I had a hand transplant, so I've got a right hand again. Mentally it was quite a different situation for me. Obviously it was still a major surgery, but I'd kind of chosen to do this one. I was gaining something rather than losing something.
Without active antimicrobials, the outcome for Becca would certainly have been much worse and likely would have been fatal. The threat of AMR, as it relates to cases like Becca, is that in future we might not be able to treat these rapidly progressive infection syndromes with appropriate antibiotics, which would result almost certainly in poor outcomes for patients. To tackle the AMR problem, here in Southampton, our research is focused on 3 main themes. Firstly, we're developing and testing new vaccines to keep our population healthier and infection-free for longer. Secondly, we're designing and trialling new diagnostic tests so that we can identify the exact infection type that's causing a patient to present to hospital. That will allow us to tailor their therapy and will prevent antibiotic overuse. Thirdly, we're developing new therapeutics so that into the future we have therapeutic options available for people that have the most resistant infection types. Stories like this will become more common as bacteria become more resistant to antibiotics. However, it's my opinion that we can overcome this issue by investing adequately in research.